I'm Orlando Gripper. I am a patient living with sickle cell disease, but also I'm the chief exec of a sickle cell specific company called Sanias Health and the chief patient officer there. I'll pause there from an intro perspective.
My name's Dr. Oliver Shastri. I'm the UK team lead for sickle cell disease at Pfizer in the UK. We wanted a real candid view of the patient experience. And I think, all too often, if you were to ask a patient about their sickle cell disease in the clinic, you'd probably get quite a filtered response. And interestingly, I think people are a lot more open to sharing their experiences on social media. And I think there's various reasons for that, but it's possibly to do with, online community and other people who may be, experiencing similar things. But by doing this, we can gather insights on a grand scale. So we can, use the AI algorithm to comb through data that's in the public domain on, all of the popular social media sites, and then analyze by capturing that data, identifying key themes, and then analyzing that data for sentiment. So we can essentially say, is this a neutral, a positive, or a negative experience? And I think disproportionately, the thing that we found that was interesting with this is that it wasn't just restricted to what we had heard from patients, which is negative experiences when seeking healthcare. Actually, this is kind of across the board in all 6 of the themes that we found. And this is with relationships or family planning or when accessing healthcare. So I think the problem is much greater than we initially first thought.
I wouldn't say it surprises me in terms of what the patients are saying. I think what is most surprising is that colleagues or provider systems, etc., have not thought of looking at this problem in this way. So I think that was, that was new for me as I thought about it. I think, as Ollie said earlier, for me, what might be surprising to patients is to know that so many other patients, or might not be surprising, are having the exact experiences they might be having. And I think this is a really great vehicle to help them to say to policymakers, to regulators, to providers, to clinicians, this is what we all think is happening. This is what we've all been saying. How can you help us to improve a pathway in terms of better access and care?
So over a 12-month period between, I think it was May 22 and May 23, we identified close to around 46,000 posts, and there were many hundreds of thousands of interactions, and this is things like likes and shares. And over this 1-year period, there were 4 notable peaks, and these were linked to organizational and patient-led campaigns. A random sample of around 500 of these posts were then selected for further qualitative analysis for these emergent themes and then sentiment, which we briefly discussed. And out of these, so we then identified these 6 key themes, and the 6 key themes were management of sickle cell disease within the UK National Health Service, living with the disease, the importance of community, burden over lifetime, and awareness of sickle cell disease and access to treatment. So these were the 6 key themes. And overall, the majority of these posts were neutral in tone, but in every area, the negative sentiment outweighed the positive, which is a tremendous shame. And I suppose this tells us that patients are generally more likely to have a negative experience in many aspects of normal life. We've heard about it anecdotally, but to actually capture and measure that, it's quite difficult. So this research provides us with evidence of a broad health inequity experienced by sickle cell patients. So I'll give you a couple of examples. 1/3 of posts related to treatment and management were negative in tone. For example, 31% of people reported they experienced a lack of empathy and prejudice when seeking treatment. and 88% felt that their pain was often dismissed. And we know that sickle cell patients suffer with painful crises called vaso-occlusive crises, and that can require, quite strong painkillers. And we know that when patients come to the accident emergency department, sometimes they aren't treated as fairly as we would like.
And in that moment, they're hopping onto Twitter and they're saying, I've been in the ED for 5 hours or for 12 hours and I've been treated this way. And all of these things are happening simultaneously. You've got, people probably going on TikTok, people probably going on Instagram, etc. So, but for me, I thought as we went through the data and the approach and the platforms, I thought this is really insightful in terms of how the patients are activated to at least have a voice in that very difficult period of their journey.
We want to try and address that health inequity. And this is one small step on a long journey. So we're definitely not there. We've identified the problem and we've started to measure it, but this is in its infancy. What we really want to do is put measures in place, especially a collaborative approach between the pharmaceutical industry and the National Health Service. So maybe what we could do is target our educational campaigns and our materials to areas where we know there has been a poorer experience, to try and raise that awareness. So the next time a sickle cell patient goes in, there's more understanding and awareness of this condition.
Fundamentally, from a patient perspective, the end point for us has been how can we improve access, outcomes, experience, and quality of care, right? And that's really, really important. And if you imagine all of this data exists, right? You could look it up, I could look it up. Maybe we don't all have AI and machine learning algorithms, but it's there. But what we thought would be really valuable, which is why we've collaborated on this, is how do we consolidate all of this and have it available to clinical colleagues at ASH, across the NHS, etc., so that they can look at what are these negative sentiments that patients are coming back with, where are the greatest area of unmet need for these patients, and how can we improve it? So that for us is really important.
And I think just, further to that point, we want to be as inclusive as possible with getting the message out there. It's going to be in the scientific domain, but we don't want to forget that actually a lot of these issues run through the community and not everybody is going to be a scientist. So I think, the next steps with this piece of research in particular would be to maybe develop a plain language summary and have it in a nice condensed digestible format that would be more accessible to the general public to really get that message out there.